So thank you very much for inviting me to speak. In this session, I'm going to give you an overview of the approach by which vets can help to support the progression of sport horses through their careers, the tools that we have to help us, and the treatments which we can use to optimize the horse's performance so that it can fulfill its potential. I very much enjoyed looking at the pictures in Laura's talk. I couldn't understand very much, but she's clearly an outstanding athlete. Two of the words that I did pick out, the two words in English, were never satisfied. These are two words that perfectly describe a lot of the top level riders that I work with. They're never satisfied with what they have. They're always hungry for more success. This can create a challenge for the vet who's trying to improve their horses, keep them fit and healthy, and help the rider to achieve their best results. But it's very rewarding when they get there and through perseverance and hard work and win the medals. I thought I would introduce myself to start with. I was brought up with horses in Ireland. I was show jumping from an early age. When I was not at school, I was at the stables and knew that I wanted to have a career with horses. I went to England at the age of 18 to study veterinary medicine at the Royal Veterinary College in London. During my time at university, I worked as a rider for a well-known horse dealer. Through him, I gained many contacts through the show jumping, eventing and racing worlds. Probably learned as much working in a dealing yard as I did at university. When I graduated in 2003, I went to work for sport horse practice in southern England. The vet who I went to work for, Eamon McLaughlin, was the person who inspired me most during my time of study with his practical and logical approach to sport horse problems. In 2010, I set up my own veterinary practice, Equine Sport Vets, with an emphasis on treating lameness and poor performance problems in elite level sport horses. We treat horses in many disciplines, including dressage, show jumping, 3-day eventing, flat and national hunt racing, polo, driving, endurance, occasionally reining. We now have clients in 46 countries on every continent except Antarctica, so if anybody has any horses in Antarctica, I'm happy to go and see them, trying to complete the set. We have many Finnish clients in England, and through them I began travelling to Finland in 2013, and I've been officially working for Team Finland since 2015. So, as equestrian enthusiasts, we are the custodians of the horse. We're lucky to work with these fabulous animals which can perform for us in multiple and diverse disciplines. They weren't intended by nature to do the things that we want them to do. They were designed to be grazing animals and provide food for predators. We've domesticated them and adapted them for our needs. In return, I believe it's our responsibility to give them the most comfortable life that we possibly can. Having said that, they're going to need some help. I'm here to talk about how the vet can help, but one of the most important things is to have a team of professional people with different specialties involved with the horse. This diagram shows some of them, but actually there should be many more arms coming out from this spider diagram because there's a huge number of people involved with any one successful competition horse. Those people can help to optimize the training and performance of the horse and all add into its success. Every day I find myself talking to different people involved with the horse about different aspects of the horse's well-being. So the farrier may notice a change in the hoof development, the shoe wear. The physical therapist may be finding a soreness that they can't treat effectively, or the horse didn't have before. The rider, groom, or trainer may have concerns about the horse's performance or well-being. What all of these people are trying to achieve, what we're all trying to do together, is the best possible result for each individual horse. We all work hard at our individual jobs, and if we pull together as a team, it means that we can make a much bigger difference for the horse. So the vet's role, the vet is involved with the horse throughout his career, from an initial examination through to ongoing monitoring of its health, with occasional elective therapeutic interventions. Those are very big words for giving it some treatment. And occasional emergency treatment, we hope not too often. So there's some scientific studies looking at reasons for time out of training. In this study of show jumpers in Europe, 77% of days lost to training were due to non-acute, 55%, or acute, 22% orthopedic injuries. In another study of racing yards in Newmarket in England, the overall injury rate was 23 to 26% per year. The majority of my work is orthopedic work, so it's lameness, sore backs, anything involving the musculoskeletal system. I will talk quite a lot about that, but I'm also going to talk about the other things that come together to make the horse overall healthy. So, in the young horse assessment, I will often examine a horse first in a pre-purchase examination on a check-over of a young horse that a rider or breeder has identified as having a particular talent. Typically, I'll be told this horse has incredible movement, it's got fantastic jumping technique, or it's brave as a lion cross country. We want to keep it, we want to go to the top with it. My job is to try and determine whether this horse has the physical building blocks to be able to carry this ability forward to the top. In this examination, there are 3 boxes that I want to tick. So they're up here. So the first, conformation. The second is soundness. And the third is the diagnostic images looking below the surface. In the ideal world, we'll have a horse that has perfect conformation, is perfectly sound, and has wonderful radiographs, plus masses of athletic ability. These horses are few and far between, and in today's world cost a lot of money. In the real world, where finances may limit what you can buy, compromises may have to be made in some of these ideals. In this situation, I try to tick 2 out of these 3 boxes. So conformation is the first thing. There's an ideal which applies to most equestrian sports. We all know more or less what a horse with good conformation looks like. So when viewed from the front like this, we're looking for even muscling of the neck and shoulders, straight limbs, not twisting to the inside or the outside, not too narrow in the chest, which would be my criticism of this horse, is a little bit narrow in the chest. But at this point, I should point out that I see a lot of top-level show jumpers that actually turn in a little bit in the front feet, and I believe, although we don't see this as an ideal conformation, it actually helps them to push up off the floor and get their shoulders out of the way and make a better shape in front of the fences. So there are variations on what perfect is. This is a photo from the rear. When viewed from the rear, we want to see even muscling of the pelvis. We want to see even muscling of the upper hind limbs, the thighs. We want to see even structure of the bones in the pelvis, that the frame that everything's sitting on is level and symmetrical. And we want to see straight limbs from side to side, not too far out or too far in. When we look, when we look at the horse from the side, we want to see a very slight angle to the hocks. Nope, not going on. We want to see a very slight angle to the hocks. We want to see a very slight angle to the stifles. We want to see that the horse is not too long in the pastern, not too long in the cannonbone, and that we are more or less even on top of the pelvis and the withers. Some horses are bred for conformational traits which will make their job easy. For example, a Westphalian horse might have a lower pelvis, higher wither, which allows it to collect more easily for dressage movement. Modern show jumpers tend to be bred as this horse is a little bit straight in the stifle, generates more push off the floor, bigger lever arm when they sit down to jump to move through the stifle. And eventers may select for a slightly longer cannonbone, which gives them a longer galloping stride. So the first thing I do is examine the horse at rest. Here I'm going to be checking obviously the legs, the pelvis, the back, everything that I spoke about, but I'm also looking at other things like the eyes and the heart. So this is a horse that is blind in one eye. The pupil is closed, it doesn't respond to light, and the horse has no vision in that eye. The owner did not know that the horse was blind in this eye until it was vetted for somebody else to buy. It had been jumping well, it was not spooky or difficult to handle. They had no idea that the horse was blind in this eye, and actually, it probably isn't going to affect his competition career, but it's something you need to know about. If they'd had this horse checked over as a young horse, then they would have known it before they went to sell it. So the next thing is a trot-up exam. So we want to see the horse move on a level, even surface, so that we can see the foot placement as well as whether the horse is lame or not. We're looking for basic signs. We're looking for signs of lameness, such as a head nod, hip hike, or an irregularity in the placement of the limbs, crossing the leg or hitching the leg. The other thing that I start to look at this point is cadence. Cadence is very important to me. This is the way that the horse carries itself. It's related to core muscle strength. And some horses just seem to have an inherently strong core, and these horses are more likely to be athletes. There's an impression of athleticism with these horses, a sort of swagger when they move. And these horses give a similar impression when you ride them. You feel that they grow underneath you. They feel strong and stable even when they're young. The next thing I do is manipulative tests. So here showing flexion test, front and hind limbs. I do flexion tests on each leg. Sometimes I do other tests based on findings from the initial palpation. So for example, if an area of the leg is painful to palpate, I will apply pressure to this area to see whether I can induce lameness. Flexion tests should not cause pain in a young horse. In an older horse, pain after flexion tests might point to low-grade lameness. It's something that could be addressed before it becomes a problem. So then we see them lunge on the hard. Obviously, basic soundness is assessed again, and a comparison can be made to how the horse moves on the straight line. A common criticism, particularly when I go to vet horses, is that competition horses are not asked to perform on a hard surface. But again, this is a valuable way of identifying low-grade lameness problems before they become bad enough to cause a lameness on a more forgiving surface. We then see them lunge on a soft surface, so we can compare how they move on the hard and on the soft. And again, we're looking at cadence and balance. Some horses are never very coordinated on the lunge, even when they're way on in their competition careers. They just don't lunge well. Some horses are initially weak. This is the ideal. If they're initially weak, then they'll improve over time. They get better coordination. And you can address this through exercises to help their coordination and modify their training. A horse which can balance itself by itself on the lunge without a rider is much less likely to get injured. If a horse is reliant on the rider balancing it all the time, the rider only has to make one mistake or lose control, and that horse can suffer an injury. So then we see the horse ridden. I compare the ridden exam to test driving a car. So if you go to test drive a car, you want to test the brakes, the accelerator, the steering, you want to move it through the gears, you want to see how responsive it is, how it handles through the corners. Do you want to buy it? Do you not? Same thing when you look at a horse. When I look at a horse as a vet, do I see problems? Do I see issues with the steering? Do I see issues with the stopping? Do I see problems when the horse is asked to move up a gear, when it's asked to collect more? Dressage horses I'll see do movement appropriate to their level of work. Sometimes I'll see jumpers jumping a variety of fences, particularly if the rider reports a problem with that. And I perform manipulative tests again during the written examination. So I'll do flexion tests again. Sometimes I'll do stretching tests to try and alleviate discomfort or stiffness in particular areas. I pay a lot of attention to what the rider is feeling during the written exam. The rider may communicate to me that the horse feels uncomfortable in a certain movement, where it may not be obvious to me when watching from the ground because of the adjustments that the rider is making. Particularly good riders. Sometimes good riders can be riding a horse and it looks fantastic, and you get on and ride it and it feels terrible. The changes that they make without even thinking about it, and the balance and the self-carriage of the horse are they're too big to underestimate. I used to ride a lot of horses for lameness examinations when I was a junior vet, and it is remarkable how bad a horse can feel to ride when it looks good from the ground. The written exam also allows me to assess how the rider might be affecting the horse. So even very good riders can be one-sided, and we have to take that into account when we're looking at the problems that the horse has. Sometimes I'll see the horse ridden by different riders to rule out rider-related imbalances. And the most important part of my written exam, of the entire examination actually, is symmetry. No horse, no rider moves exactly the same on both reins. But in a sound horse, there should be very little difference. When there's a clear difference between left and right, there is usually a physical weakness. I then do a second trot up. So I always do a second trot up on pre-purchase examinations, and always repeat flexing tests at this stage. Horses which I examine for purchase often have not had very much exercise since the deal was agreed. They've sold the horse, they put it in the box. People don't want the horse to get injured, and they don't want it to fail its betting. That means on the first trot up, the horse is often quite explosive. Explosive energy and adrenaline may not be easy to assess properly, and then this might not be evident. So normally on the second trot up, they're more relaxed and you can see the real picture. Equally, you can have the situation with an older horse where they may be a bit stiff on the first trot, but they improve after exercise. So repeating this element gives you a complete picture of what's going on with the horse's soundness and how it's likely to cope with competition work. After the physical exam, I'll often be taking a complete set of radiographs. This is an example of what we might take of one individual horse. It looks like a lot of pictures, but actually what we want is to get a complete picture of everything that's happening in this horse's joints and bones in pretty much all the places where we might experience problems. This includes the front feet, the front knees, all four fetlocks, the hocks, the stifles, the neck, and the back. The information gained from the radiographs is used to try and predict which areas might be causing discomfort or where the horse may develop problems in the future. The radiographic findings need to be correlated to the symptoms shown by the horse. So we might see a horse that doesn't show any lameness but has some quite severe radiographic findings. That horse is obviously coping with that, but we have to weigh up whether it's going to cope in the long term. Equally, we might have a horse that is lame, doesn't show anything on radiography. That means we need to look at it with other imaging techniques. In a young horse at the start of his competition career, the radiographs may show up developmental abnormalities, such as chips and cysts. So this horse has a chip in the hock, it actually has several chips. This horse has a cyst here in the stifle. So those are things which may or may not cause a problem, but for the ones which are definitely likely to cause problems, we can do surgery to remove the chip or to treat the cyst. Hopefully do this before the horse becomes lame or before other changes start to happen in the joint, such as arthritis, which can be career-threatening. We then do ultrasound scans. This again is just an illustration of the number of scans that we will do on a standard pre-purchase on a high-value sport horse. This has become increasingly common. It used to be that you just took radiographs. A lot more people are asking for scans now, and it actually provides quite a lot of information. We're looking at the soft tissue structures, which we know are just as important to us as the bony structures. This is particularly important for horses which perform at speed. So we can take measurements of tendons, so that we can check over time how those horses' tendons are responding to exercise. We can do this with ligaments as well. We can measure basically anything on ultrasound. But if I examine a young event horse, race horse, endurance horse, any horse that's going to perform at speed and with an element where their tendons might break down, if we know how they were to start with, then if they start to develop problems, we know where we stand in terms of the previous history. The next thing is blood sampling. Again, not something that used to be done as standard, but more and more we're being asked at the time of vetting, can you take a blood sample so that we know what the normals are for the horse or whether there's anything underlying. It's a simple thing to do. Obviously it adds expense, but in the long run, it's a good thing to have so that you have a baseline for that horse. So the summary of my young horse examination is that I aim to have as much information as possible about the current health of the horse, and the future athletic potential of the horse. The clinical evaluation is the most critical thing, and I will repeat the same examination protocol at each subsequent examination so I can identify changes in the way of going or suboptimal performance. Having a clear picture of how the horse presents when it is healthy and performing normally makes it much easier to identify problems early in the future. The diagnostic information gained at this examination, so the radiographs, the scans, the blood tests, are your reference points to identify changes later in the horse's career. Sometimes I go and vet a horse, we do all the scans, all the x-rays, the blood tests, everything's good, and the owner gets the bill and says, why did we do all this? Everything's good, now I've had to pay a load of money and we didn't find anything. Well, actually, we know that we have a perfect starting point in that case. In the more real world situation where we often find something, we have things that we know about and we know how to manage. So the results of the examination can be used to guide the rider on how to manage the horse to give the best possible chance of making it to the top. Any advice, any recommendations regarding training, shoeing, dentistry, physical therapy or nutrition can be discussed with the relevant professionals, and they can be asked for their input to give the horse the best possible help. Again, this is the team approach. So when I first go to examine a horse, I spend a lot of time discussing with the people connected with the horse about its day-to-day management. This might be the rider, the owner, the trainer, often most importantly the groom. They're the people who know the horse best, spend most time with it, and you can get very valuable information from them. I can then, if necessary, liaise with the farrier, the physical therapist or other vets about ongoing management of the horse. The main thing is communication between everybody involved. So just as a case example of a horse with poor conformation, this is a photo of a show jumper which has quite a severe, and I don't think the photos really do justice, it has quite a severe varus deformity of this fetlock. So the fetlock comes down here and then turns in quite dramatically, twists round. This is it from the front, the cannon bone comes down here and then the fetlock turns to the inside. I was first asked to see this horse when it was a 6-year-old. The rider hadn't shown it to me before, as because of the bent leg, they didn't think it was worth spending money on. But it had gone and won the National 6-Year-Old Championships, and all of a sudden they said, well actually, this could be a Grand Prix horse, this could be a good one. We're going to have to keep it because we haven't been able to sell it because of its twisted leg. So we'd like you to look at it, see if there's anything you can do to help it through its competition career. When we trotted the horse up, the horse was lame on that left foreleg. So we did a specific nerve block in this area here to block out this part of the fetlock joint. You can see from this horse's conformation that it puts excess pressure down through the side of the fetlock. That block made it sound. We were able to identify from that the pain was localized to that area. So then the first thing I did was to call the farrier. I've got umpteen different drugs that I can inject into this fetlock. I've got things that I can give systemically. There's any number of treatments you can do with it. But unless you can change the biomechanics, this horse is going to keep going lame because it keeps putting pressure through that area. Farrier came and saw the horse. We discussed what to do with it, and this is what we came up with. So this horse is shod with a shoe and pad. The pad is thicker on the outside, and the shoe is wider on the outside. So when that foot hits the ground, the outside comes into contact sooner, it takes more force, and relieves the pressure on the inside of the joint. The horse is now 9 years old and jumping at top level. I like to think if we had checked this horse earlier in his career, then we may actually have a chance of getting it to this level without it becoming lame. Equally, there's a good chance that this horse is going to have limitations to its career because of that conformation. It's likely to get ongoing lameness on and off in that left front, and it's not going to have as much longevity as a horse with a straight leg. So this is the second example. This one's about cadence and balance, what I talked about being very important to me. So this is a 4-year-old horse I was asked to examine because the rider wasn't happy about the way the horse moved. The horse was very well bred. The owner believed with this breeding, this was going to be a top show jumper. The rider felt that the horse did not feel safe to ride and was awed, but couldn't say why. This is the horse in walk. I think awed is the right description. So the horse is pacing rather than walking in a 4-time trot, so it's moving the front, hind legs on each side together at the same time. It seems to be feeling its way along. It's like it's kind of searching for the ground a little bit with its feet. You can't say inherently that there's something terribly wrong with this horse, but it's not. You know, I spend all day, every day watching horses walk up and down, and this horse is not normal. So now for comparison, I'm going to show you a horse with a normal walk. So this horse, not as good a video because we've got all this rubbish sitting around, but this horse has a very clear, even walk, 4-beat walk, placing the legs without having to think about where his legs are. The rider has to think about where she's going, she's about to disappear. She will come back eventually. So this is a normal horse, and just doesn't have to think about walking. The other horse is thinking about where it's going all the time. This is the first horse in trot. So you've got the lunge whip to keep it moving. And it's not terrible, but something isn't right about this horse. The cadence isn't there, it doesn't carry itself in balance. It's kind of wobbling a bit here and there. Is it lame, is it not? Is it about to crash into me? This is the horse on the lunge. So in trot, the horse appears poorly coordinated. Again, legs going a little bit everywhere. No 2 strides are the same really with this horse. Often it looks a bit lame right forward. Then it looks stiff in both hind legs. I'm looking at this horse thinking, is it lame? Should I block it? You know, where should I start really? Should I block the front legs, the back legs? In the canter, again, that's not a bad canter to start with, but then we kind of lose our balance and it looks lame, just not a normal horse. I don't think it'll get much better. We'll go on to the next one. This is on the right rein. So again, maybe it looks lame left forward. Maybe it's stiff behind. And maybe it's going to fall over. This is what I'm saying about cadence and balance. This horse just can't really carry itself. It can't hold its body in a way that it can keep moving in a regular fashion. And you could put some of this down to exuberance of being a young horse and whatever, but we'd launched this horse for a long time before this video was taken, and it didn't really get better. It just, there was no, you know, for a few strides there it looks okay, and then it's all over the place again. This is why the rider was worried about riding the horse to be safe. I think it had actually fallen over with her, in the same as we saw in the video. So again, for comparison, this is the first horse that we saw in the straight line. The video was a bit jerky, but this horse carries itself in balance, it holds its frame in one way, and the legs move in a regular rhythm. We'll go into canter in a minute, and you'll see it goes off on the wrong lead, immediately corrects it. The other horse, when it went on the wrong lead, didn't know it was on the wrong lead, didn't do anything about it, didn't do anything to correct it. So, this is the radiograph, and I don't think it's probably show up very well on the screen, it probably looks quite dark. We did some nerve blocks and things on this horse to see did it have a lameness or whatever, but the fundamental thing was that no nerve blocks changed it. and we wound up x-raying the neck. This horse has an abnormality here. That's a piece of bone that's pressing on the spinal cord. And that was our explanation for why this horse doesn't move in a normal fashion. The horse went for a second opinion with a neurologist. It was diagnosed as a grade 2 wobbler, and it did not have a competition career. The other horse I showed had good cadence and good balance. That was sold to America for no money. So when a problem occurs, we get three main categories of issue in performance horses. The first is overt lameness, the second is medical conditions, and the third is poor performance. So the first thing is overt lameness. The horse is limping. I don't have a video for this because I don't have enough space in my PowerPoint, but you can all imagine what a horse limping looks like. That's a straightforward lameness examination. We're going to see the horse in hand only, and the first thing to do, the obvious thing, is to check the foot for bruising or infection. I always tell vets who come and train with me that when they go to see a lame horse, they should get out of the car with the hoof testers in their hand. Not forget the hoof testers and get involved in making a complicated diagnosis. Then they miss the obvious foot problem, and a couple of days later, the pus comes out. The owner doesn't want to pay the bill. So the next thing we do is nerve blocks. If we haven't found anything obvious, there's no obvious area of heat or inflammation in the leg, then we'll do nerve blocks to try and find out what's wrong. If the horse is very lame, we won't do nerve blocks because we may be suspecting a fracture then. So we'll take x-rays of the leg first to try and rule out anything that might, if we make the horse sound, maybe put weight on the leg, might give us an absolute catastrophe. Sometimes if we've got a thickness or a swelling on the leg or an area of heat or pain, we'll go directly to scanning or directly to radiography, but the fundamental principle for me is that you should block the horse to find out where it's wrong. I often hear people say things like that the horse looks lame in the shoulder, or it must be the suspensory because the lameness is on the outside of the circle. And in reality, different horses show different patterns with the same source of lameness. So you've got to do the nerve blocks. We can then do the imaging, ultrasound, x-rays. We can send them for more advanced imaging if we're not finding the things we can do at home. So we can send them for MRI scanning, CT, nuclear scintigraphy. For the horse that's very lame and doesn't block out anywhere, nuclear scintigraphy is often done as a bit of a fishing expedition. Sometimes doesn't find anything, and then you know you're dealing with soft tissue. But sometimes you'll find a fracture in an odd area that you can't get to. So the next thing is medical conditions. So we get horses that have problems with the guts, the breathing, the heart, skin allergies, infections, all things that aren't making the horse lame but are really going to compromise its ability to perform. When most people think about reasons for horses not making it to important competitions, they think of things like the horse being lame, having back problems, whatever. But I've actually had more problems getting horses to competitions with skin issues, colic, respiratory problems, what we would call medical rather than orthopedic problems. And the reality is that these horses are under a lot of pressure when they're being trained towards big competition. Their immune systems are compromised, and then other diseases can take hold that the horse would not otherwise get. Lower airway inflammation, so problems with breathing deep in the lungs, gastric ulceration, is what we've got here. Skin allergy, skin allergy. These are all consequences of the intensive way that we manage competition horses. And there isn't really a way around these things are going to happen, but we can try and manage the horse to avoid them as much as possible. Again, as with a lame horse, careful clinical examination and if necessary further testing are the key to obtaining an accurate diagnosis, and management changes can be made then to specifically address that accurate diagnosis. The next thing is poor performance. About 90% of my work falls into this category. I'll often be asked to examine a horse because the horse is performing poorly in competitions, or it's changed in some way, as noticed by the rider, the owner, the trainer, maybe the physical therapist or another vet. And again, the team approach, all those people are vital in identifying these subtle problems, so they might be looking at a slightly different thing that they pick up that somebody else wouldn't. The chance of successfully treating these horses is much higher than the horses in the first category where they're obviously lame because they haven't got to the stage where they've got severe inflammation, making them incredibly sore. However, often it's not easy to identify the problems, and often it takes more time and more attention to detail. A clear idea of how the horse normally moves or normally performs is extremely helpful when looking for these subtle problems, which is why having checked the horse thoroughly when it's healthy is a big advantage. I go back to my initial examination for that. Equally, sometimes if I haven't seen a horse before, people will show me videos. This is what it looks like normally jumping around fences, and this is what it did in the last 2 competitions or whatever, so that I can try and understand what's changed about the horse. The presenting symptoms vary according to the discipline. In dressage horses, they may be struggling to perform one counter pirouette on one rein when both have always been good. Weak or half pass to one side when they've always been good in both. I mean, some horses just aren't as good on one rein as on the other anyway, but what we're looking at is a change in the way they move, something that wasn't there before. In show jumpers, they might have started jumping off to one side instead of jumping straight. They might be stopping for no reason, or other abnormalities in their performance. The eventers might be knocking down fences show jumping more than they normally do, or tiring too quickly cross country. I've had one endurance horse which went lame on a couple of rides at 40 kilometres, but every time we turned up to check it the next day, it was sound. So an open mind is important. We've got to consider the medical problems as well as the orthopaedics. For example, horses with sore backs can also get gastric ulcers and vice versa. My approach is the same as described for the initial examination. When I identify a deficiency in the movement of the area of soreness, I'll often perform anaesthetic blocks, nerve blocks, ride the horse again, see if we've changed what it's been doing. I want to know, in the horse that doesn't do the pirouettes well on both reins or doesn't do the half pass well one way, can I do a block which resolves that problem? Can I actually make a difference to it? If I can't block it, then maybe it is a training issue. But if I can block it and make the horse better with the same rider and the same way of riding, then there's a pain source which we need to address. In the endurance horse that went lame at 40 kilometres, we had to send it for a 40 kilometre ride in the morning and go and look at it straight afterwards, and that horse turned out to have a suspension problem. The blocking process can take a long time, but it can be very rewarding in identifying the exact area which is causing a specific problem. We use imaging again, x-rays, ultrasound, etc. They're helpful after identifying the painful area, but they don't always show dramatic abnormalities when you've got a horse that's got a performance problem rather than an overt lameness. Treatment depends on the condition we find. I'll talk about that a bit later. And again, when the problem has been identified, it's important to talk to the team of people involved about how to modify the training to make the horse more comfortable. Treatment of low-grade problems can often be done without the need for significant time off work, whereas if you let those problems run, the horse may wind up being significantly lame and needing a lot of time off. Taking away that low-grade pain allows the horse to perform comfortably and optimally so that it can continue to develop its back, its muscles, its core strength. Often when there's a low-grade problem, just giving the horse rest won't help, and the problem will return once the horse is put under pressure again. So a lot of these we treat them and we keep working. So imaging. This is radiography. This is a radiograph of a horse with kissing spines. X-rays show only abnormalities. So there might be areas of increased bone, like these white areas here, areas of reduced bone, like these cysts in the bone here and here, or areas where the bones are in an abnormal position, which is effectively what this radiograph is about, that all these spines are pushed together, but there should be a separation between them. The strength of radiography is that the majority of the radiographic views are standardized, so we can very easily compare things over a period of time or things that have been taken by different people. With the technology that we now have, it's possible to do high quality digital radiography in any settings. We can do it stable, we can do it in the field, wherever. The weakness though of radiography is it doesn't tell us whether that abnormal area is recent, active, or whether it's old and really not causing a problem. Next thing is ultrasound. So we use ultrasound to look at soft tissue problems. It's also very useful for looking at bone surfaces, so things happen on bone surfaces which show up on ultrasound before you see them on radiographs. The fundamental thing is soft tissue problems. If this horse has a severe tendinitis in both superficipes and flexor tendons. Something we can do in addition with ultrasound scanning is we can look at the blood flow in the tissue, and that, where it's different to radiography, is it tells us whether things are actually active. So this is a horse that had ongoing suspensory trouble on and off. This is the suspensory area when the horse was good, it doesn't show any increased blood flow. This is the suspensory area when the horse was lame, and we've got increased blood flow. So we can monitor using this, it's called colour flow Doppler ultrasound to monitor injuries. The other thing we can use to monitor injuries is this ultrasound tissue characterization. So we get this pretty picture on the tendons that tells us actually about the quality of the tendon fibre in there and how likely that tendon is to break down. This uses special equipment and a special compounding software to take this grayscale image. And this is a horse that has here a dark area on the edge of the tendon, here grayscale again. It changes it into these fibres which tells us green is good, red is bad. This horse is developing problems in this area where it's got the inflammation. And this horse was monitored serially with these scans and managed to run 4 times at 3-star level during a season when it had this inflammation, which then returned to stud. So MRI scanning. MRI is used for assessment of soft tissues and internal bone structures, particularly useful for visualizing the soft tissue structures of the hoof, which is what's shown on this MRI scan. Different MRI sequences can show different types of tissue in more or less detail. And sequences which show chemical activity can also help us in determining which abnormalities are active and causing inflammation. It's very useful for things like hoof problems where we can't see them with ultrasound. They're soft tissue. We would normally use ultrasound for soft tissue. We can't see them because of the hoof capsule, which doesn't allow ultrasound to penetrate. One weakness of MRI is it doesn't show cartilage details, so we sometimes have horses that have quite severe cartilage problems and we can't pick it up any other way than doing surgery. It gives us a large amount of information about a very small area. It does very small slices, so this standing MRI scan does slices which are 4 millimeters wide, and so you get a very large number of images of a small area. So sometimes people say, can we not just MRI scan the entire horse? We're limited to going up to the knee and up to the hock in the standing scanners anyway, because of the amount of information that it gives us. We really need to know where the problem is before we go looking at it with MRI. So then we've got CT scanning. A CT is effectively 3-dimensional radiography. Produces fantastic detail of bony structures and also shows some soft tissue information. The images can be compounded by computer programs to produce 3-dimensional reconstructions. We mainly use CT for diagnosis of head and upper neck problems, as the current equipment uses a horizontal tube, so the horse must be anaesthetized if you're going to scan the legs, and most people don't want the horse to have an anesthetic. There are risks involved. So where we would like to see nice CT pictures of the legs to give us our lovely diagnosis, people don't want their horse to go under general anesthetic. And this is where this next one comes in. So this is a new thing. This is robotic CT scanning. The idea of this scanner is that it can image the entire horse without the need for anesthesia. And you can then produce those 3D reconstructions. So you sedate the horse and these robotic arms move around on either side of it and pick up images from all over the horse. This equipment is currently being developed at the New Bolton Centre in the United States, and hopefully in a few years' time it's going to be widely available. We're quite excited about this. The other thing that I mentioned before, nuclear scintigraphy. In nuclear scintigraphy, a chemical with a radioactive marker is injected into the horse's bloodstream. That chemical is attracted to inflamed bone, and then we see that inflamed bone when we pass a gamma camera over the horse. It shows up as these hot spots which tell us where there's bone inflammation. That can be very useful in telling us that there are bony abnormalities in deeper areas which are difficult to assess with other imaging modalities like the pelvis, the deep parts of the lumbar spine. But the weakness of soft tissue, of nuclear scintigraphy is that it doesn't show soft tissue problems. Then we've got endoscopy, again moving more to the medical side, where we've got a horse with a breathing problem. We're going to put an endoscope up its throat and look at what's happening. This is a horse with a left laryngeal hemiplegia, so you can see this area here is moving with the horse's breathing. So the horse breathes in, and this flap moves up and out. On the other side, this one is hanging in, it never moves. So this horse, when it works, is making a whistle or a roaring sound, and that's going to affect its ability to get air in. So the next thing we can do with endoscopy is gastroscopy, where we look for gastric ulcers. We can visualize the entire lining of the esophagus, so the food pipe going down to the stomach, and the first part of the small intestine. The typical problem that we find is gastric ulceration, which is estimated to affect 60% at least of sport horses. And the type and degree of ulceration is important. So a lot of people say, why don't we just put it on gastric guard or just treat the ulcers? You can get ulcers here in one part of the lining of the stomach, or you can get ulcers in different parts of the lining of the stomach, which we treat differently. So really we need to scope the horse so that we know that, and we can do the best for the horse. Then we've got dynamic endoscopy. So some horses make a noise, are abnormal in their breathing, and we can't find anything when we look at them with the static scope, the scope just with the horse stood in front of us, not moving. And so there's a special scope that we can fit to a headpiece, pass the scope up the nostril, lock it in place so that we can see the larynx, this area here, the voice box, and then work the horse and watch that horse on a remote monitor and see what the throat is doing while the horse is working. This is a horse that is cantering, so we can see, we've got the information about what its airway actually does when it canters. You can see some of the later pictures that the larynx actually sucks backwards, and this is a horse that the throat was closing and losing air because of that, and we had to pull the larynx forward surgically. Then we have things like echocardiography. So these are heart scans. This is stuff that has to be done by, or it doesn't have to be, but is best done by specialists in cardiology who are doing that stuff all the time. It needs specialist interpretation, and the typical reason for doing that would be that the horse has a heart murmur when we listen to the heart, or some other suspicion of a cardiac abnormality. Cardiac abnormalities also can be looked at by electrocardiography. We attach electrodes to the horse. It can be looked at rest or when it's working, and we look at the electrical trace that the heart produces. If the horse has a rhythm disturbance, then we can find that and we can try and do something about it. So modern technology means that digital images can be taken, they can be stored, they can be transmitted to experts anywhere in the world. And this has vastly improved our ability to make detailed and accurate diagnoses in a short period of time. The diagnoses that we sometimes make, broadly categorized, they're soft tissue bruising, muscle pain, joint pain, ligament or tendon problem, fracture, heart problem, respiratory problem, gastrointestinal problem, reproductive problem. That could be basically anything. And I won't talk about specific diagnoses in a lot of detail here. For treatment, we have, again, a lot of options. So a lot of the modern treatment is aimed at regenerative therapies, things called autologous treatments, where we actually take the tissues or the fluids from the body, we process them or we culture them, and we inject them back into an area to try and improve the healing that's taking place in the injured ligament, tendon, or joint. The benefit of these therapies is that we're trying to repair tissue, not just mask inflammation. They're normally used during a period of rest or reduced exercise following acute injury, with the exception of IRAP, which sometimes can be used while the horse is continuing an exercise. It has anti-inflammatory properties, so we sometimes use them to treat joints. We have non-invasive treatments like shockwave. This is a shockwave machine we have in our practice. Shockwave therapy, class 4 laser therapy are things that are used from the outside, so we're not doing anything invasive, we're not sticking needles in the horse, we're not doing surgery or anything like that, and we're trying to repair the tissue. They can also be used to reduce pain and inflammation in horses that are carrying on in work. The other thing that's come about recently is gene therapy. So this is a new development, and they're reporting rapid healing of tendon and ligament injuries following injection of something called plasma DNA into the injured area. It's very early days. It's a study that's been done in Japan and England, and they're claiming that they have very good results, but one of the issues we have is that at the moment gene therapy isn't permitted for FEI or racing competition. So then we have disease-modifying drugs, things like bisphosphonate drugs, people might have heard of, Tildren, Osphos, there's a new one called Zoledronate. Those are drugs that we inject into the horse's system. They're not directly pain-killing, but they aim to limit the process which can produce pain. So you're trying to change what's happening in the body, and as the outcome of that, you get less inflammation generated and less pain. We have things like pentazan and polysulfated glycosamine glycans, which is Adequan. They act as chondroprotectants or joint protectors, and they can also enhance the healing of low-grade injuries in tendons, joints, and ligaments. They can be used during FEI competition, so they're quite useful to us for horses that are getting a little bit sore when they're on competition. Then we've got polyacrylamide hydrogels, like this Arthronid. This is something that can be injected into a joint which has cartilage damage or arthritis. It's a new drug and it has a new way of working compared to anything else that we use. So it attracts water molecules to hydrate the joint and produce effectively a cushioning in the joint. So that joint that has arthritis and is rubbing and creating discomfort for the horse, we're effectively injecting a synthetic cushion in there, and that persists in the joint for up to 10 years. And the interesting thing about that is that when we did studies on it in Denmark, before the drug was licensed, the horses were better after 2 years than they were after 3 months. And that's something that's unheard of with arthritis. Normally things get worse over time, not better, even with some of the strong anti-inflammatory drugs we've got. There's no competition withdrawal time for these drugs, but it's not something you actually use during competition. It's a treatment that you do outside of that. Anti-acid medications are also disease modifying, so where we've got inflammation in the stomach, we'll give omeprazole, which is gastric acid, or ulceracol, and peptazole, and they switch off the acid production to allow the ulcers to heal. Those are legal for use during FEI competitions and legal for use during competition in Finland, but some national federations don't allow the use of gastric acid during competition. There are other anti-acid drugs as well, but omeprazole is the best known and the most effective. Antibiotics are also disease modifying. We have horses that have low-grade infections which can be given antibiotics and can continue in work without any problem. We have to be careful though about when we give them because of the risk to human health of antibiotic resistance. Antibiotics are legal for use during FEI competition, but not in certain national federations such as here in Finland. So then we've got anti-inflammatory and pain-killing medications, which are quite a big category. They're basically the mainstay of what we use in treating sport horse problems. We're looking at inflammation and pain, so we want to use anti-inflammatories and painkillers. Strenuous exercise causes inflammation in the tissues and that leads to pain. And in order to continue performing strenuous exercise, which is effectively what we're doing with competition horses, that pain needs to be controlled. Pain-killing medications are not allowed during competition because of the potential for abuse, keeping a horse going but shouldn't be. And masking pain with high levels of painkiller is not something that most people would do, but some of the pressures of competition, it's better that they keep that illegal. From a horse welfare point of view, I go back to the comment that I made at the start that what we're doing is not effectively what nature intended for them. So if we're not allowed to use the painkillers during competition, then it's up to us to use them judiciously outside of competition during the training periods and applying a withdrawal time so that those substances aren't in the horse's system when it actually goes to compete. We can use anti-inflammatory drugs in several ways, so systemic, so non-steroidal drugs like phenylbutazone and phenidine and metacam. They're good for short-term pain relief. They're good for sometimes getting a horse back into work where it's got multiple arthritic issues, but they're not allowed during competitions, so they have limited usefulness. The other thing is corticosteroids, which might be used to treat medical conditions in particular. We can give steroids in the feet over a period of time, but not allowed during competition, have to give them all the time. Antihistamines, I include those because they treat inflammation in the skin, like that horse that I showed you earlier with skin inflammation. Most antihistamines also have some level of sedation as a side effect. So we have to apply quite long withdrawal times because they've been abused in the past for that sedation effect in competition. I put homeopathic drugs also with a question mark. There's limited scientific evidence about homeopathic drugs. Some people believe they work, some people don't. And I think the worst they can do really is no harm. But the main thing is not to choose a homeopathic drug over a conventional drug in a horse which has a serious or life-threatening problem. Then we've got local administration. So things like joint injections. Often I hear that once you start injecting the horse's joints, its career is going to be over soon, or that you can only inject the horse's joints 3 times and then it'll stop working. There are all sorts of myths around it, but in reality the main reason for joint injection is that the horse is starting to develop arthritis. Low grade though it may be, is getting arthritis, which is an inevitable consequence of the strain that we put on their joints with high level athletic performance. And I've got horses in my care that have had the same joints injected every year for 10 years, and they've continued to perform at high level. Human research has shown that maintaining muscle strength is the most important factor in keeping patients with arthritis mobile. So if we can get rid of the pain, we can keep the muscle strength, and then the horse is likely to be able to continue in a longer career. So things that we use in joints, we can use non-steroidal drugs in joints as well. Spelled it wrong there. So we've got non-steroids that we can inject into joints. They'll be used in horses that are high risk for laminitis or other problems where we don't want to use steroids. We use steroids in joints and they're really the mainstay. Shut down the inflammation, get rid of the pain, horse can keep working. Then we'll use hyaluronic acid, often in combination with corticosteroids. People tend to think of hyaluronic acid as a lubricant for joints because it's a very thick substance, but actually once it gets into the joint, it thins out and it doesn't have a huge amount of lubricating effect. It's more of an anti-inflammatory effect. So then we have other therapies, things like prolotherapy, which is injection of mild irritant around ligaments or tendons or into muscles, which creates a stabilizing effect that allows the horse to work where there's a weak area. They can be very useful for that, but it can only be used where the horse can work hard after treatment and build the muscle up, going back to what I said about arthritis, we want to build muscle and maintain muscle. If the horse is lame, it's not a reasonable option. Then we've got mesotherapy, which is what's shown in the picture here. So we're using this multiple needle injector to inject tiny amounts into the mesoderm, which is a layer of the skin which conducts the nerve impulses. That then affects the feedback mechanism for the nervous system, where we've got a horse with typically an intensely painful back. Doing this mesotherapy, although it looks nasty because it's a lot of injections, once you've done that therapy, the horse gets immediate relief, and we get very big improvements. The horses that have been very sore in the back, they can be back training, jumping again in 4 days. We've got then things like inhaled therapies, which I don't have a picture of here, so horses with respiratory conditions and things like that might have to be managed at home or in competitions with the use of an inhaler or the equivalent of a human asthma device or a nebulizer. And we can use different drugs in those. We can really only use saline in those nebulizers in competitions to try and moisten the respiratory secretions and keep that inflammation at bay. Then there's acupuncture. I don't do acupuncture myself, but a lot of my clients have acupuncture done on their horses. It seems to work for one horse and not for another. There doesn't seem to be any particular pattern as to why that is. I don't know about this Chinese medicine and all the rest of it, but I think what it does do is stimulate areas to produce more blood flow and to try and bring some healing and some anti-inflammatory effect to those areas. Nutritional supplements, I could do a whole talk on. They're such a big field. The main thing about nutritional supplements is make sure that the manufacturer can guarantee that they're not doping if you're going to use them in competition horses. There have been a lot of cases of inadvertent doping because of ingredients in nutritional supplements. Herbal doesn't mean doping free. So then we got surgery. This is a picture of a horse with a torn tendon, and that's how it's seen. We couldn't see anything on ultrasound with this horse. There wasn't anything much to see on MRI, and when we did tenoscopy surgery, we could see this torn tendon. Also used for things like fracture repair, joint surgeries. Neurectomy is another one which is a little bit controversial. It's not technically competition legal, but there are some neurectomy surgeries after which the horse can compete, because there's a bit of ambiguity in the wording of the FEI rules. Effectively, people can't find it, so they tend to carry on competing. And it's not very clear whether that's actually acceptable or not. The main thing is in terms of the welfare of the horse. If those cases are selected carefully, then the horse's welfare won't suffer from removing a small area of sensation. Respiratory surgery is another thing I've already mentioned. So that horse that had the breathing problem, that area can be tied open so that the horse can breathe well. And then there's a surgery called electrocardioversion, which if I got the time at the end, I might put up the video of, because it's quite fun to watch, where they effectively restart the heart when it's got a rhythm disturbance. The horse goes under general anesthetic and the heart is restarted. So we've got other professionals then, things like remedial farriery. And one of the most important things, even in a horse that doesn't have foot problems, in essence, is foot balance. So we spend a lot of time looking at the foot balance, talking to the farrier, and asking them to shoe the feet according to what's happening inside the foot as well as what they can see from the outside. We quite often take these balance radiographs at 6 monthly intervals. And what I do is I encourage the farrier to shoe the leg to land comfortably rather than shoot for a beautiful x-ray or a beautiful foot on the end of the leg. So quite often the owners, they have a perception of how the horse's foot should look. They think the horse's foot should look pretty and symmetrical, which in an ideal world it does. But where we've got a horse with a conformational problem, we want it to be functional, which may mean that we have to make the foot look ugly. The vet needs to support the farrier in this, because quite often you've got pressure from the owner saying, why did you do that? The horse's foot looks horrible. But actually they've made the horse land in a comfortable way, and that horse is going to have a longer career as a competition horse as a consequence. Then physical therapy, there's a picture of the physio. And I often see horses because the physical therapist, the osteopath, the physio, the chiropractor, whoever has identified the problem, or sometimes I'll recommend physical therapy after treatment, or quite often I will, as an adjunct to the treatment that I've done. And the physical therapist is the person who can regularly monitor the horse's soundness, when often people only want to call the vet when there's an issue that the physio can't help. So input from the physio is very important in what we can achieve afterwards. So then ongoing management. After we've done the treatment or the horse has been rested, it's important to plan the return to exercise and the ongoing training schedule to avoid re-injury. The rehabilitation plan is different according to the injury, different according to the individual horse, but again there's a team effort involving all these people and more in getting that horse back up and running again, or keeping it up and running and reducing the chance of re-injury. The main focus of my rehabilitation plans is to reduce the time that the horse spends inactive. So I hear about a lot of horses that have got low-grade injuries that are on box rest and anti-inflammatories. And in my opinion, that isn't any good for it. These horses need to keep their muscles strong. Because they've got a little bit of lameness in one place, it doesn't benefit them to stand in the box. They should be doing some level of exercise, even if it's only walking a little bit each day. Because what you find otherwise is that the box rest makes the issue that you're treating better, and then you get the horse back into work and it's got other problems because everything else has lost its power and strength. One thing I always emphasize to riders in rehabilitation as well as in ongoing work is cross-training. so they should work outside of their chosen discipline. And this is an inherent part of the eventing work because they have to do different tasks anyway, but it's difficult to convince dressage riders sometimes to get out of the arena and difficult to get show jumpers to do flat work. Apart from the physical benefits of this type of work, mixing the type of work that a horse does stimulates their brain, keeps them fresh and willing to work for us. Where possible, the riders should set targets for what they want to achieve in a season or in a time period, and then regular veterinary checkups can be arranged and included in the training plan to ensure that problems aren't built up. So then we go to the championship, and the talk's entitled From Young Horse to Gold Medal Winner, and all the things that I've discussed are tools that are available to the vet in order to give the horse the best possible chance of making it to the top. By having a thorough knowledge of the horse, a systematic way of examining it, the vet can be in the best possible position to help the horse experience its problems at a major championship. But at that major championship, often the care of the horse is handed over from the home vet to the team vet, and that's where communication is again important, because when the pressure's on and you need to know what the history is on the horse, and again you don't have that knowledge of how it looked when it was normal, it's important to talk to everybody involved and find out just how bad the horse's problems are and whether it can continue in competition. When the pressure is on though, that careful preparation will pay off and maybe there's a chance of winning a gold medal. This is a picture of Kira with her silver medal in 1990. Hopefully quite soon we can have a Finnish rider who goes one better. Thank you very much.
Thank you very much, Eamon. Kiitoksia paljon, Eamon. Ja nyt meillä on tähän ruokataukoon aikaa. So are you available for a few questions?
Absolutely. Yeah.
Yes. So, ole hyvä.
Thank you, Eamon, for your presentation. I'd like to know concerning the pre-purchase examinations, what you do. Is it routine that you take drugs during pre-purchase?
Always. It's technically optional in the UK, but we don't give clients the option. We tell them we're taking a blood sample regardless, because it protects us as well as them. It protects all three people involved in the transaction. So you've got the seller who may be accused of giving the horse something that the horse goes wrong in the future. And if you've got a blood sample, you can prove that the horse was clean when it was vetted. You've got the buyer, obviously, where if something goes wrong, they want to know whether there's something with blood. What we do is we take the blood and we store it for 6 months. Sometimes in the high level horses, if they're going to continue immediately in competition, we will test the blood immediately. Or if they're going, typically the horse is going into other countries or continents, we'll test the blood immediately because it's not very easy to send them back if there's a problem. And then the main thing for me is it protects the vet. So I've had horses that I've vetted that have gone wrong, and I like to think I'm good at what I do and that I don't miss things. I've had horses that I've vetted that have gone wrong. The buyer's been jumping up and down saying they're going to sue me, and then we test the blood and find that actually the horse had painkiller in the system when I vetted him. So if I just leave that to the buyer to decide, that can leave me in a difficult position, so I insist on taking it.
And it's included in the pre-purchase examination, the price?
Included in the price, and it's not terribly expensive to take it and store it.
Thank you.
Anybody? Sir.
What do you think as a vet perspective, when we build up sport horses, is there a bigger risk that they are injured in the age of 5 to 6 or to 7 to 8 or later?
I think it depends on the individual horse. It's different for different disciplines as well. So a lot of dressage horses in particular, well, I say dressage horses and show jumpers, we get suspension problems at quite a young age. And most people see suspension problems as basically being potentially an end to a horse's career or a severe limitation on it. We get horses that are training while they're growing. And I have a theory about it which may not be at all correct, and I don't know how you can test it, but sometimes their bones and their soft tissues are growing at slightly different rates. So then we get soft tissue problems in particular where soft tissues join onto bone with things like suspension pain and sesamoiditis. and those horses have pain for a period of time. We have to reduce their exercise level and manage that pain, but then they can continue to work. Equally, for the eventers, we tend to get with the very good athletic young horses. They will sail through to kind of intermediate 2-star level, maybe start getting 3 stars, and then all of a sudden they start to get problems. And we're left, sometimes we'll have a couple of years when there's one problem after another, and interruptions in the training schedule, and it seems like there's a time period that they take to toughen up. And that then when they get through that, they'll continue as high-level horses for well into their teens without having further problems. So I think the main thing is when you get an injury is not to give up.